Man, I just cannot believe how many of you turned out today. This is absolutely unbelievable, and Dr. Gingrey is going to be a tough act to follow. You'll see I'm not near as good as that. I'm certainly not near as polished. But I can't even get my partners to show up to a meeting on a routine basis. There's only 3 of us. This is absolutely monumental to get this many doctors away from the practices for a day to do something as important as save our health care. My name is Scott Barbour. I'm not an activist. I'm not a public speaker, which will become obvious, and I am not a politician. I'm an orthopedic surgeon, and I practice out of Atlanta, Georgia. I've been a husband for 16 years, and I got a wonderful wife, Alyssa. I have 2 beautiful little girls that I wish I was at home with right now and not up here taking care of this. And like you, I'm a concerned citizen, and I'm very concerned about the direction our healthcare has taken over the last several months. I am absolutely honored to be here with all of the physicians and all the other people who've come out to take the time to let our voices be heard. But before I speak to each of you, I would like to speak directly to somebody else. Mr. President, over the last several months, the American people have heard a lot of rhetoric suggesting that our healthcare system is somehow inferior to other nations. Tales of high infant mortality, tales of routine denial of care, and poor healthcare outcomes than other nations have been commonplace. Doctors have been accused of actually mutilating their patients for financial gain. President Obama, shame on you. The truth is that we have the greatest healthcare system in the world. We have better outcomes. We have better access to care. We have better technology. Our U.S. hospitals conduct more clinical trials than any other country in the entire world. We do have the greatest healthcare. We do have the greatest technology. We have the most modern equipment. People from all over the world come to the United States to train. People from all corners of the globe come here to receive their medical care. And despite all these facts, we have a very real possibility of having our healthcare system destroyed. Limitations to specialists and possible wait times in emergency rooms. This is our future. Patient care will no longer be between a patient and a doctor, but will be dictated by a faceless, unaccountable bureaucrat in Washington. Why are we here today? There are those that believe we are here to serve our own self-interest. They believe that we are motivated by money, by greed, or some other selfish reason. I'm not going to trouble myself to speak to them, for they don't understand what it means to be a physician. They don't know what drives each and every one of us. I'm going to speak to each of you. I'd like to take a few minutes to share a story with you that I think a lot of you physicians out there will find familiar. Like you, I believe it was my calling in life to become a physician, and when I was fairly young, I decided that I wanted to go into medicine. I started college at the University of California, Berkeley in 1984, and I can remember one day, after long hours of study, looking out the plate glass window of the science building at the rest of the campus getting ready for the weekend, and I had to turn back to my Bunsen burner for another 4 hours of science lab. I often thought how nice it would be to take easier classes, but that was not my destiny. I wanted to be a doctor. As I passed through the years of intensive study, I eventually graduated and was admitted to medical school in 1992. I was so excited to drink from the fountain of knowledge. When I arrived, they stuck a fire hose in my mouth, turned it on, and told me not to spill a drop. I remember those classes: anatomy, biochemistry, physiology, neuroscience, microbiology, embryology, pathology, nutrition, death and dying, medical ethics, just to name a few. There was so much to learn, so much to understand, and after 2 years of 8 a.m. to 5 p.m. classes, 4 to 8 hours of studying every night, countless hours in the labs, we were ready to pass into the second year. We took a 2-day board exam, and this was a doorway into our clinical years, where we began to interact with patients, and we began to transform ourselves from scientists into healers. The pace of study remained intense, and I can remember one 3-month period during general surgery when I literally never saw the light of day. Our shifts ended after midnight, and we had to be back at rounds at 4 a.m. the next day. But even though it was brutal, I was learning and experiencing so much, not just about science, but just about what it took to make people whole. For me, this was a humbling time. I worked with so many different people, so many different medical conditions. I saw so much human suffering and so much faith. There were times I was brought to tears by my patients' suffering. There were other times when I rejoiced with tears of joy in the salvation of others. Each experience allowed me to grow as a physician and as a person. And finally, the end of medical school arrived, and that was really the beginning of my journey as a physician. Orthopedic residency started for me in 1996. I was 31 years old. I made $27,000 a year. I was working 100 to 120 hours a week. Don't get me wrong, I'm not complaining. I was thriving. On-the-job training, taking care of patients on the floors, in the operating rooms, at the trauma center, in the emergency rooms, and clinics furthered my knowledge and my understanding. I fondly look back on those post-call days when I had been up for at least 36 hours. On my way home, I used to put my car in park because I was afraid if I fell asleep, I would nudge the car in front of me. I can remember my wife coming out to the garage and waking me up in the front seat of my car because I had pulled into the garage, but I had fallen asleep.